Thank you for joining us. We will begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. We are also joined this morning by Dr. James Hildreth, President and CEO of Meharry Medical College. Dr. Michael Caldwell, Metro's Public Health Director, and Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department are here with us to answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now, before we get started with this morning's COVID-19 briefing, I'd like to say a word about our citywide tornado recovery efforts. While the coronavirus has disrupted so many parts of our civic and community lives, Metro government remains committed to the long-term recovery of all tornado victims. Now, here are some numbers from this tornado earlier this month. 1,989 residential properties and 253 commercial properties were damaged by this devastating storm. Since March 3rd, Metro government and our partners have cleared 116 blocked roads and 60 alleyways, repaired infrastructure at 335 intersections, and hauled 5,000 loads of debris totaling 239,000 cubic yards, and also restored power to nearly 50,000 homes. The Community Foundation of Middle Tennessee is continuing to disperse expedited grants to agencies providing emergency assistance to tornado victims and has raised $6.5 million in grants and contributions from over 20,000 donors. $1.2 million in grants have already been deployed from the fund to 39 nonprofits to help tornado relief efforts, including Hands on Nashville, Lee Chapel AME Church, Gideon's Army, and the Martha O'Brien Center. The Community Foundation's Advisory Council is meeting again today to consider 25 additional grants. To find a list of grantee organizations providing individual assistance to tornado survivors, visit tornadoresponse.com, tornadoresponse.com, which is very easy to remember. Now, we are working closely with community partners to adjust to a virtual service model that helps ensure that displaced Nashvillians have what they need to stay safe, including safe from COVID-19. We are grateful to the many social workers, case managers, and religious organizations who are finding safe ways to provide our residents with the support they need. If you need support from a Metro department, you can call 311 from inside Davidson County. Residents in need of social service support can dial 211, and that is a 24/7, 365-day information and referral helpline that provides resources to cover basic needs in times of crisis. Although local in-person FEMA facilities have temporarily closed, FEMA help is still just a phone call or mouse click away. 3,062 Nashvillians have registered with FEMA already. Survivors can register, check the status of their applications, and get answers to questions about disaster assistance at disasterassistance.gov or by calling 800-621-3362. The Tennessee Department of Human Services is accepting applications for disaster supplemental nutrition assistance. And the Families First Temporary Assistance for Needy Families Emergency Cash Assistance Program. Applications can be submitted online at ten.gov/human services. ten.gov/human services. And the Metropolitan Action Commission has programs that help with rent, mortgage, utility payments, and rental deposits. Learn more by calling 615-862-8860. Now, we remain steadfast in our dedication to the March 3rd tornado victims, and will continue helping our neighborhoods recover and rebuild. Now, I am grateful to everyone who is continuing to observe the Safer at Home order. Our public health experts have told us that staying at home and practicing safe social distancing is the best way to flatten the curve. By staying home, we can save lives and get back to work sooner. Essential businesses and institutions, including grocery stores, hospitals, and pharmacies, will continue to operate. But unless your errand is truly necessary, please remain in your home and tell your family and friends of the importance of following the safer at home order. Avoid becoming a vector for coronavirus. At the local government level, we are working as quickly as possible with our community partners to provide relief to all residents. I urge everyone to visit covid19.nashville.gov to find a link to the COVID-19 Response Fund and information about how to obtain individual, financial, food, housing, unemployment, tax filing, and utility payment assistance. Now, hopes have been raised that the federal package going through right now will provide relief to individuals, businesses, as well as to states and cities. We are hopeful that it will do that, but full details aren't known at this time. Payments to individuals, extensions of unemployment benefits, guaranteed loans to businesses, money for hospitals and health systems, as well as money to states and cities will help fund the response. Nashville and the rest of the nation will need economic relief, and I urge our representatives in Washington to act quickly to pass legislation that prioritizes working families, including freelancers and gig economy workers, furloughed employees, and small business owners, as well as cities. Later today, we will be announcing details about emergency shelters that will provide our unhoused and unsheltered neighbors with a place to stay that offers proper social distancing protocols and convenient access to important social services. Now, I am grateful once again to Dr. James Hildreth, president of Meharry Medical College and an infectious disease expert, who has joined us again this morning with more insight into the COVID-19 and Nashville's response to the disease. We continue our close collaboration with the state's COVID-19 Unified Command to obtain the needed medical supplies to get our community assessment centers fully operational, and we will keep everyone updated on the progress of these efforts. I'd also like to remind everyone who has the means to do so to visit covid19.nashville.gov and contribute to the COVID-19 Response Fund, which was created with the help of the United Way of Greater Nashville to support Nashvillians facing hardship during this time. And now I'll turn it over to Dr. Jahangir, chair of the Metro Coronavirus Task Force. Thank you very much.
Thank you, Mayor Cooper, and good morning, everyone. Here's the latest update for Nashville. We now have a total of 293 confirmed cases with one confirmed fatality. That's an increase of 36 cases in the past 24 hours. We continue to anticipate an increase in positive cases that reflects what we are seeing all over this country. Yesterday, we confirmed a 2-month-old child tested positive for the virus. I'm happy to report the child has mild symptoms and is at home doing well. The oldest patient is still 73 years old. Of the confirmed cases, 12 are currently hospitalized. 228 cases are self-isolating at home and have mild and manageable symptoms. 52 individuals who were confirmed cases have recovered and are now cleared. I can also report to you this morning that as of 8 a.m. yesterday, there have been slightly more than 3,300 COVID-19 tests conducted for Nashville-Davidson County residents. Here's some additional information. Orders for the COVID-19 test kits and swabs are still backlogged in the United States. Right now, that is what is keeping us from opening our community assessment centers. This is our top priority, and we have been and continue to call on the state to help us secure these kits every day. I know our state partners are as frustrated as we are about this shortage. They understand these assessment centers are important to Nashville's COVID-19 response and are working with us to help resolve this matter. We are in contact with the state's Unified Command, the State Department of Health, and the Tennessee Emergency Management Agency many times every day, trying to get the supplies we need to open. We also are working with the private sector, both locally and nationally, to obtain the supplies we need. There is some encouraging news. We believe that we have enough personal protective equipment to keep our healthcare workers safe at these centers. Tents are up, healthcare professionals are on standby. Once we get the testing supplies, we will open. But we still do need your help. While right now we may have enough supplies to operate the centers for a finite amount of time, we still need more. Not just for our centers, but also for our first responders who are in our community. If you're a healthcare professional or a healthcare facility with supplies that you are not using, then please donate them. Go to our website, covid19.nashville.gov, to see what we need. If you want to make a smaller amount of supply donation, then please bring them to the Community Resource Center on Omohundra Place. This is open Monday through Saturday from 10 a.m. to 4 p.m. Thanks to everyone who is helping. I also want to share some additional information. Today, we will open facilities to take care of some of the most vulnerable in our city, the homeless. There will be 3 facilities available for sheltering. One will be for people who are well, so they practice safe social distancing. Another for those who have been tested and need to self-isolate until they get their results. Finally, a 3rd shelter will be open for those who have tested positive, but don't need to be hospitalized, a place for them to self-isolate and recover. I truly want to thank our partners, our nonprofits, the business community, along with the Metro employees for helping make this happen. Yesterday, the Metro Public Health Department opened an information hotline to answer questions about COVID-19. 136 people have called so far and were able to speak with a healthcare professional. This COVID-19 information line is open from 7 a.m. to 7 p.m. 7 days a week. Please call 615-862-7777, and healthcare professionals are standing by to answer your questions. And you can also get the latest information on our website, covid19.nashville.gov. Finally, let's talk about the weather. The forecast for the next several days is very promising. With highs in the 80s and a slight chance of rain, spring has arrived. And it's okay to go out, get some exercise, and enjoy nature. Just remember to practice social distancing. Stay 6 feet from each other. Under the safer at home order, you can go out to essential businesses and services, but don't leave home unless it's absolutely necessary. That's the best thing you can do to help fight this virus and flatten the curve. You can help us save lives. As we continue to be apart, we are truly all in this together. Thank you so much for each of you for all you are doing to make our city safe. Now I'd like to turn it over to Dr. James Hildreth, President and CEO of Meharry Medical College.
Good morning, Nashville. I'm grateful for the mayor for allowing me to come and share some science that underpins the decisions that are being made. And today I want to share some science related to why we've been asked to shelter for 14 days. And to do that, I need to explain some basic biology of viruses that infect our respiratory system. So imagine Jill goes to the grocery store, and she's walking to the grocery store. She grabs a grocery shopping cart, as we all do. And as she's walking into the store, she touches her face, not realizing that the shopper who used the cart before her is suffering from a virus infection. So Jill has unknowingly exposed herself to the virus by touching the shopping cart and then touching her face. She has placed the virus right smack in her T-zone. Remember, the T-zone is your eyes, your nose, and your mouth. So she's placed the virus just where it needs to be. The virus now attaches itself to a cell and begins to make new copies of itself. And viruses are remarkable machines because within a matter of hours, they can make thousands of copies of themselves from a single cell. Now, these viruses leave that cell and infect lots of surrounding cells, and before you know it, lots of cells have become infected. The process repeats itself until finally the immune system gets activated and responds. And at this point, your body is trying to rid itself of the virus. Fluids are produced that attempt to wash the virus and the infected cells out of the body, hence the runny nose. The immune cells release small proteins that go to the brain that turn up the body's thermostat. That's when the fever starts. And when the virus reaches the lungs, immune cells charge in and attack the virus and the tissue around it, and pneumonia begins to set in. So in the early stages of infection, when only a few cells are infecting our body, we have no sense of being infected. It's only when the immune system responds and attempts to remove the virus from our body that we are aware that we've been infected. The symptoms we experience, the sneezing, coughing, runny nose, they're all reflecting the body's attempt to eliminate the virus. The period between when you first get exposed to a virus and when you start to have symptoms is called the incubation period. And the incubation period depends on a number of things, but two of them are how many viruses infects us at the start of the event. If it's a single virus, it may take longer. If it's lots of viruses, it may take a shorter period of time. The other thing is, how did we acquire the virus? And if you inhale the virus and it gets directly into your lungs, the symptoms will start sooner than if it has to make its way down into our lungs. Okay. So, a very scientific, thorough review of data by some scientists at Johns Hopkins, University of Massachusetts, and other places have determined that the median time for incubation of COVID-19 virus is 5 days, and that by 12 days, 98% of the people exposed will show symptoms. So we know that the incubation period for COVID-19 is somewhere between 5 days and 12 days. And that is the basis for asking us to shelter for 14 days. This achieves two things. Sheltering in place is sort of a substitute for COVID-19 test, because within that 14 days, anyone who's positive will show symptoms and manifest themselves as being COVID-19 positive. The other thing it does is it prevents new infections. If all of us stay in our house and we don't interact with a lot of people, we minimize the chances of acquiring the infection. And those are two very important goals: to identify who is already positive and to keep new positive cases from occurring. And that is the scientific basis for the sheltering in place for 14 days. Some of you have commented to me that this seems like a bit of an overreaction, and it does seem overwhelming at times. But please understand that this is a truly extraordinary event. Keep in mind that not since 1918 have we had to deal with something like this. And an extraordinary challenge requires an extraordinary response, and that's exactly what we're doing. So remember, the other part of this is to protect your T-zone, your eyes, your nose, and your mouth, because that's where viruses can easily infect us. We got this, Nashville. And remember, COVID-19 needs a vector, and our job is to not become a vector. So please don't be a vector for COVID-19. Thank you.
Thank you, Dr. Hildreth. We will now start the Q&A portion of today's briefing. I will announce your name out loud from the podium, at which point you may proceed by asking your question over the air. We'll start with Brett Kelman at the Tennessean.
Hi, everyone. Good morning. I wanted to dig in a little bit more into the assessment centers. Can you say specifically how many assessment centers are ready to go right now if they had test kits? And if there is any estimation when those test kits will arrive? And if there is enough protective equipment to open the centers if test kits were received today?
Dr. Jungier.
Brett, thank you so much for that question. To answer the last part of your question first is yes, we have enough protective equipment to open the testing centers for a reasonable duration of time. To answer your questions, there will be, right now there are 3 community assessment centers with tents up, total of approximately 9 to 10 tents in which we can conduct testing. And we have the personal protective equipment. What we need are the tests. And every single day, many times a day, we've spoken with our state partners, the Unified Command. I've called private labs. I mean, there's not a stone that we're not turning over to get these tests. And the moment we get them, then yes, I mean, staffing is ready, facilities are ready, PPE is ready. We just need the swabs. And what we're not going to do is not provide the people of Nashville the standard of care that is expected when you're being assessed for this. I will highlight, though, we have some amazing facilities right here in town, health systems, that are assessing people. As I just mentioned, nearly 3,300 tests have been conducted in Metro Davidson County. So people are being assessed, people are being taken care of. We just want to augment that for all our residents.
Tosin Vakile at WSMV.
Good morning, everyone. This is Tosin with News 4. I have two questions. The first is, I believe Dr. Kahanger said they're opening shelters today. My question is, how many shelters are there? Where are they located? Is there like a process for people to, like, can anyone just show up, or is there a process by which people come to these centers? And my second question, and I'm not sure who can answer this, there are reports in different states about police stopping people and asking them to prove if they are part of an essential business while they're out on the streets. Is that something we're doing, we plan to do in regards to the safer at home order?
So the first question is about the number of shelters and where they're located.
The first question is about the home shelters.
And the second question is about law enforcement stopping folks and asking them why they're out in public.
So I will address the shelter question. As I mentioned in my remarks, there will be a total of 3 facilities as right now. We have plans, if need be, to extend that. The first 2 shelters that I mentioned, one for unhoused individuals who want to practice social distancing, as well as the shelter that will house individuals who are tested but don't have results yet. Both of those will be at the fairgrounds. Regarding the third facility for individuals who have been tested positive, will need to be self-isolated. That facility, we have our plans. We're not ready to announce that yet. It'll probably be later today we'll announce that. Regarding the enforcement question, I'm going to defer to my colleague, Dr. Caldwell, as this falls in his purview. Thank you.
Good morning. We're already seeing great voluntary cooperation throughout the public, and I've already see people themselves, the community, asking each other this question of why might you be out in public, and trying to help each other to follow the order of the Department of Health as well as the mayor. So right now, law enforcement is observing, but nobody from law enforcement is specifically going to be asking anybody why they might be out in public. We all know what we need to do right now, and we just want to try to help everyone be as cooperative as possible. So thanks for that question.
Mr. Peter White at the Tribune. Peter? Peter, are you there? Let's go on to Sergio Martinez Beltran at WPLN.
Hi, good morning. Thank you for answering our questions today. I mean, we've heard reports of playgrounds that were open and populated yesterday afternoon. My question is, how is enforcement carried out in these locations and places that are hard to close?
Dr. Caldwell.
Well, that's an excellent point, and once we observed this, I worked with our Commissioner of Parks, Monique Odom, as well as the Metro Park Police Force, to make sure that we are out and educating people and informing them what the requirements are now. So we need the public's help also to let people know what we're asking them to do and not to do. We want people to go out and enjoy the parks, greenways, and other places that are open, but please maintain that social distance of 6 feet away. I myself have observed a number of people who kind of look at it as a time to kind of get together because you are been isolating, and it's hard to remember to keep that 6 feet apart. So we need everyone to participate, to help us educate and in some ways gently enforce this. But we're out there, and we're there to help the community be a visible symbol to remind them, please keep your social distance. Don't be a vector, and help us move this virus away from Nashville. Thank you.
And the last question is from Kathleen Jacob at Fox 17.
Good morning. I just have a quick question about construction. I know that it is listed, or most construction is listed as one of those essential businesses, but we've noticed that a lot of it does seem to have halted around Nashville. I wanted to see if that's something that the city has been urging for a lot of their bigger projects. We've noticed some that it's normally just residential things. Is it up to contractors, just kind of at their discretion, or how is that working?
Sure. So the question is construction sites and the nature as an essential service.
We have been communicating to everyone to enforce the social distances as much as practicable. There are elements to different construction projects which lend themselves very easily to accomplish this. And I want to make sure that all of the construction companies are doing their best to maintain the social distancing. As you've noticed, there are many different types of construction. These projects right now are permitted to go forward. But as we observe, for example, maybe a whole bunch of the construction workers lining up around the lunch truck, we're going to ask for them to specifically remember to space out as much as possible. So that's one example. And we need to keep sharing and reminding everyone to do our part to maintain that 6 feet social distance as much as we can throughout the day. Thank you.
So it looks like that is all the media questions at this time. A video recording of today's broadcast will be made available later on this afternoon. Thank you, everyone, for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to